Welcome back to Restart Hygiene, and we're going to talk about dry mouth today. If you have a dry mouth, hopefully I can teach you something that will help that alleviate your symptoms, because dry mouth is terrible. There's consequences. I'm going to share with you the signs, the consequences, some holistic options today. So let's first talk about how your mouth feels when it's dry. So signs and symptoms of dry mouth are a pasty mouth. You feel like your tongue is stuck. You can't chew, swallow good. You actually have a fissured tongue. Your tongue is not hydrated, so it starts to crack, as well as your lips, they start cracking. And you also have bad breath, so you have halitosis. You would have increased cavities. You would have increased gum disease and gingivitis. So these are other signs and symptoms. One that you don't always hear about is saliva gets thick and ropey. So if your saliva is kind of thick, that could mean that you have a reduced amount of saliva. And I see this in my older patients sometimes. And also a sense of taste that would change because your saliva glands help keep everything lubricated. Even having trouble wearing your dentures. Sometimes if there's not enough saliva, there's not enough moisture and lubrication, that can make your dentures hard to wear. So remember those are really important. One last thing is persistent hoarseness or the back of your throat's dry. So hoarseness, your voice sounds raspy, that could be an issue as well. So remember that, especially if you're snoring at night, included with the other issues that we're going to talk about that you may be having. So causes can be snoring, like we talked about, or mouth breathing. It can also be medications that you're taking. I have a list from front to back that had the medications that cause dry mouth. And when I'm out at the speaking events, I'll show them to patients and they're just like, oh my gosh. So everything you take, just about everything you take, has a drying effect. For example, omeprazole for the acid reflux, that dries your mouth out. Think about when you take an antihistamine to dry up your sinuses. That is to dry up your sinuses. That dries up your mouth. And since I've been studying it more, I've noticed it more in my own health. So that's really important. Medical conditions, diabetes, some autoimmune disorders, and Hashimoto's, which is a thyroid condition, can cause dry mouth. So when I'm having conversations with patients, we're talking about their medical history. You have to look at the medical history so that we can get a full picture of everything that's going on in the body, the signs that we see. I saw these signs for years, didn't know any better, and didn't really help the patient as much as I can now. So I'm so thankful for that. The other thing is lifestyle factors. Do you smoke nicotine? Do you smoke cannabis? Do you drink a lot of caffeinated foods or drinks? That can help to dry your mouth out as well. We all know cotton mouth when you smoke cannabis, so that's really important that you keep that mouth lubricated. Aging is another one. Just because we get older, we start having these issues, and aging is another reason for our mouths to get drier. Our body's not able to produce and lubricate and do all the things it does, especially women and hormones. There's the other one we want to talk about. And then cancer therapy. If you've had cancer therapy, that can definitely dry your mouth and tissues up. If you've had head or neck radiation, that can really dry you up, and that can be a really big cause of concern. It can be a whole body effect of diseases or of effects of the dry mouth. So we want to make sure that your mouth stays lubricated. Okay. So now let's talk about the consequences. You're going to have more decay, tooth cavities. You're going to have more gum disease. You're going to have more plaque, which is going to cause these disease processes. Your teeth aren't going to feel as clean. And that's going to in turn relate to your oral and your systemic health. So if your plaque is in your mouth, you inhale it into your lungs, or it gets into your bloodstream, then it's going through your whole body. And that can be a big concern. There's other videos, and I can talk more about that if I need to, about the oral systemic link and how the bacteria and the plaque affect the whole body. So know that as well. You may have yeast in your mouth. This happens as you get older. A lot of patients with dentures or partials have more yeast. And so we want to make sure that we keep the mouth as lubricated as we can. Sores or splits in the mouth, cracked lips. This is sometimes the yeast as well. And then poor nutrition. So it's funny how if you don't get enough nutrition, you can't have good saliva, because there's a lot of vitamins, especially vitamin A, that help with your saliva flow and remineralize your teeth. But if you get to a position where you're at now, you can't eat the good foods that you need because you may not have the saliva and the moisture to ingest them, to chew them up, and to digest them, and your body ingest them and make good systems for you. So it's very, very important. Nutrition is so important as you get older too, so please don't ever underestimate that one. So I'm coming with you today with holistic options of ways that you can treat a dry mouth. My number one pick probably would be oil pulling. Oil pulling was something that was going on a couple of years ago. It was a big fad. It was supposedly a big fad, but it really is a helpful way for you to lubricate your tissues. All you have to do is take a teaspoon, or I take a finger, full of coconut oil, scratch it on my teeth, and swish it around. 3 to 5 minutes is okay. Preferably we'd do it closer to 10 minutes, but if you do it once a day, you're going to feel that natural lubrication. The tissues are going to feel like they have oil on them, and that's going to make your mouth a whole lot better. So that's my number one. Number two is hydration. You have to drink your water. You have to. And we just talked about you want to make sure you're drinking half of your body weighted ounces. So if you weigh 150 pounds, you need to drink 75 ounces of water every single day. So that's a whole lot more than it used to be if you weigh more. Also, sugar-free gums and lozenges. I love xylitol. As you know, if you've been watching me and following me, I love xylitol. It's a naturally occurring sugar alcohol. It won't drive your blood sugar up if you're diabetic, but what it really does the best at is it decreases the bacteria in your mouth. It helps your saliva to naturally flow from your saliva glands. So that's really important. I was at a speaking event this week, and a lot of patients were telling me they're using biotin. Biotin has been on the market for a long time, and it's just seeming like it's just not working for patients anymore. So I don't know if their body's getting used to it and it's just not effective. So we've got to keep coming up with new measures that we can help to stimulate those saliva glands and help our patients. The other thing is humidifier. Do you have a humidifier in your house? A lot of us have them when we have children, but when it breaks and we don't have children, we don't do the humidifier. So I do recommend that for you. Make sure you have the humidity in the air, especially at night when you're sleeping. A lot of us are mouth breathing. That's making these conditions worse. So remember that as well. And then remember dietary supplements. You want to make sure that you have good fruits and vegetables. Those are really good to help keep your saliva glands going and keep your mouth healthy, which is very important. So I want to encourage you to seek professional advice. If you do have a dry mouth, you can try these options that we've discussed today. I hope something that I told you helps you. I love going the holistic route these days. It's not something that I learned in hygiene school. This is stuff that I have tried and true learned and heard from others and patients that have really helped them. So make sure you take care of yourself, hydrate, coconut oil, watch the commercial products and some of the ingredients because they can harm you as well. And also, keep smiling. So be sure to keep smiling. Please like and comment below. Follow me and go to my website, www.restarthygiene.com. Sign up. I'm going to start doing some blogs and newsletters so that I can connect with you and teach you all the time. Thanks, guys. I appreciate you being here today.